Okay, hold on. I got to click the got it. Okay,
Got it.
ready.
All right. No, that's not how we start. Let me see. All right. Hello and welcome to the Healthy Habits for Active Aging podcast. This is episode number 4. And today we're going to talk about 5 treatment options for keeping an arthritic knee healthy. My name is Dr. Michael Gorman.
And I'm Dr. Lauren Bennett.
And we are 2 physical therapists that are from St. Louis, Missouri. And we love this podcast because it gives us a great opportunity to share some great information on a wide variety of health topics. So today we are going to delve into a little bit more about, okay, you've been told that you have knee arthritis. What are your next steps from there as far as what can you do immediately to start getting healthy?
Yes, and we've also refer back to a couple of our podcasts today. Like Dr. Gorman said, we're gonna do some things that you personally can do, and this is just an option. But there's other podcasts out there we have on cortisone injections and PRP injections, and some really, really great interviews with some doctors on pain management and stem cell therapy. So go back. But if you have been told that you have knee arthritis, Dr. Gorman and I have 5 easy, not so easy to do, but easy ways to kind of get you started and educate you in the right direction.
Right. So just imagine, let's say you're about 68 years old and you've been having some knee issues, some knee pain for about 6 months or so. You can't really ignore it anymore. So then you go to see, let's just say, an orthopedic surgeon. And the orthopedic surgeon takes an x-ray of your knee and comes back in the room and says, you have knee osteoarthritis. Well, don't freak out and don't worry, because I'm not sure what the percentages is, but I bet a really big number of adults, maybe 60, 65 and over, have knee osteoarthritis. So you don't worry about it. Don't worry about what the x-ray shows. I mean, Dr. Bennett and I have each seen patients before who have the worst looking knee x-rays, and they seem to be doing not too bad. We both have seen people that have a not too bad looking knee x-ray, and they're having a hard time. So don't worry about what the x-ray says.
Mm-hmm. Yeah, I think that's a really good point. I know from my experience, when I have seen patients, they may not have had issues for a very long time, and then all of a sudden they had like a fall, or they work in their garden all weekend and they did a lot of squatting, or they knelt on their knee, and then all of a sudden it flared up, and then they go to the doctor and have like this pretty moderate to severe osteoarthritis diagnosis based on their x-ray. And then they're just kind of like, well, where did this come from? I'm like, well, it did not happen overnight. So the way that I kind of explain it is that you can have like dormant arthritis, dormant, dormant, or you had to cut this out.
Cut that
Dormant.
out. Okay.
Oh my God. Okay. So the way that I explain it is that you can have dormant arthritis, and that it just kind of lays like really quiet for a long time, and then you do something and you flare it up. So no, that does not mean we need to go straight to the orthopedist, straight to surgery. We can calm it down again through anti-inflammatories, physical therapy, ice, compression, cortisone, whatever we need to do. That it is possible to get the knee to be not flared up again and return back to where you were before the fall or before the overactivity.
Right. That's a great point, because it's truly not well, I'm not going to say not, but oftentimes it's not the knee osteoarthritis that is giving you your knee pain. There's a lot, when we talk about the arthritis, obviously it's getting to be where you're losing cartilage in that joint, getting to be more bone on bone. There could be some osteophytes and things like that. That's such an ugly word, osteophytes.
Mm-hmm.
I wish they could have thought, well, I guess bone spurs isn't a very pretty term either. But anyway, so more than likely, your pain that you're having is not from that. So, as Lauren said, the key thing is let's get that inflammation down, because it's the inflammation in your joint that's giving you your pain and your loss of function. So let's get the inflammation down and then kind of reassess and see where we're at.
Sure. So we all know that ice is helpful to reducing inflammation, but what are the other 5 things that we can do to help get this knee moving in the right direction? So the first one is that exercise is healthy. Okay, I think that a lot of people, they don't know what to do and they think like, let's let it rest. And I know several people that fall in that category, but that's not what the research shows. The research is that you should get it moving in a pain-free range of motion, but just get it moving and start exercising it. And here we're going to tell you exactly how to do it, because you don't want to just go and do a bunch of weight and squats and a leg press. You want to kind of low load it. So bottom line is that exercise is healthy, and that research shows that the knees bear about 80% of our body weight in just standing still. But when we move and we start to walk, our knees bear about 150% of our body weight. So it makes sense that it's recommended low impact exercise like biking or swimming or rowing or walking, and even better yet, walking on more of a softer surface, is going to be more beneficial than, say, running or jogging or playing tennis that involves a bunch of cutting and stopping.
Yeah, I think that maybe we could throw a pickleball in there as well. But
That's right.
As you are the pickleball expert, but and if you recall from this may have been our first podcast or second podcast, we talked about how much time per week is recommended, and it's 150 minutes cardiovascular exercise. Is that correct? Is that what?
Yes.
What we talked? That was a long time ago, but anyway,
that's right.
It's important to know though that if you're just getting started with something, it's going to take time to ramp up to that. And if you're thinking about walking, let's just say you want to get up to where you're walking 30 minutes a day. Well, your knee may not tolerate like 30 straight minutes of walking, but maybe it will tolerate 15 minutes twice a day. So, break it up as need be. But the thing is, you have to get moving. The patients that have had a total knee and that do the best get early treatment, and early and often, because those are the patients that are going to be moving the most, and they're getting their swelling out of there, which is going to decrease their inflammation, which is going to allow for more strength, things of that. So we just encourage everyone to move in what we call in a pain-free range of motion.
And then say you want to throw some weight. So now we're going beyond just the aerobic exercise. You want to do some resistance training, because if you recall back to that podcast Dr. Gorman's talking about, it's strength training, flexibility training, and balance training. So to get the strength training component, you want to do your quadriceps, which is the muscle in the front of your knee, the hamstrings, which is in the back of the leg, and the calves and in the lower part of your leg, and then your glutes, which is on the side of your hips. So that sounds like a lot of muscles, but if you actually strengthen them, we're talking low load, so not a lot of weight, more repetitions. And if you're just starting, say you do like hamstring curl, do it at 20 or 30 pounds and do 2 sets of 15. And then as you up the weight, just to see how you tolerate that. And then as you up the weight, you decrease your reps. Okay. But getting the strength training, and we'll talk more in the next podcast about exactly reps for things, but will help create that stability of the joint, take load off of the joint, which will essentially decrease the inflammation.
And I'm so glad that you brought up the topic of glutes and glute strengthening, because most people that have knee pain on the side they have their pain, or their osteoarthritis or what have you, most times are going to have weakness of the glute on that side. As all of us age, unless we stay active, we get a lot of glute atrophy. We're just not as active, and we sit more. And so unfortunately, the glutes, we're going to lose a lot of that mass. And our glutes are the powerhouse of our body, to be honest with you. And they're going to give support to your lower back and your trunk, and they're going to give a lot of support to your knee. So when the glutes are weak, what happens is that knee, your knee on that side starts to lose stability. So it can begin to kind of bow in, and it can cause all kinds of bad things to happen. So as you're starting to strengthen, we got to make sure that we work on your glutes.
And then the last component of that is flexibility. So hamstrings for me is where what I could work on, but I see this a lot is that you have pain or an injury to your knee. It hurts to move it. So you kind of limp around on it for a couple of days. Next thing you know, it's really hard and painful to get your knee completely straight. And if you cannot get your knee completely straight, you're going to walk with quite a limp. And that's kind of where fluid settles and inflammation. It's just not great. So working on hamstring flexibility, quadricep flexibility are going to be very helpful. Even your calf, because your calf actually extends up above your knee. So that could also affect your ability to get your knee straight. But as a PT, I always kind of hammer that in, get the knee straight, and just kind of work on flexibility and get, you don't want to walk around with a bent knee with a limp.
Yeah. And, for sure, after you do your exercise, it's a good time to ice your knee for about 10 minutes or so. But not only do we want you to ice, but we want you to elevate that leg up if there's any kind of swelling at all. I mean, if there's no swelling, I wouldn't worry about it. But if you're having swelling problems, elevate that leg up. And when we talk about elevating your leg up, it's got to be way up there. It's got to be above the level of your heart. So if you're sitting in a recliner and you have your leg, up on the recliner, if you think that's elevated, that's truly not, because the leg's not above the level of your heart. So lay on a couch, lay in bed, have 3 or 4 or 5 pillows lengthwise to prop that leg up, and that will be a big help as well.
So I think the next bullet point is the most interesting to me. It's maintaining a healthy weight. So we know that just with standing up, we said that our knees bear 80% of our body weight. But I believe just with standing, that's 4 times your body weight on your knees. And so just think about when you just standing versus when you squat, I believe is like 6 times your body weight. And when you do stairs, it's 8 times your body weight. So being 10 pounds overweight increases the force on your knee approximately just 40 to 60 pounds with each step you take. Like that's a lot.
And I've had people tell me, well, I can't do anything about it now. I already have the arthritis. I've lost the cartilage. So who cares if I lose weight? Well, you can help yourself from it getting worse. Just think about that. All, the extra, just carrying 10 extra pounds, and probably most adults are carrying more than just 10 pounds of extra weight. So think about all that force that's going through that knee, each step, each stair you take. And no, you can't undo the effects of, or you can't undo the arthritis that's already in there and the loss of cartilage. You can't undo that, but you can sure help yourself to keep that from getting worse.
Yeah. And I actually read a research article that said that for every 10 pounds lost, that your risk of knee OA drops 50%.
There she goes again.
That'd be worth it for me. Okay, OA, osteoarthritis.
There you go. Those big fancy words that just roll out of her mouth. Yep, OA is osteoarthritis. So, yeah, and that we found something interesting, that the CDC reported that, what was it? 72% of adult Americans are overweight. 72%, and what of those 72%, 31% have been diagnosed with osteoarthritis. So it's just incredible.
Weight has a lot to do with knee arthritis, is what we're telling everyone.
Well, it's a good time for us to take a 30-second break, stand up, get some exercise of our own so we don't have flat glutes. And so we're going to have our sponsor, iMove PT, is going to tell us all about their company, and we are very grateful for them for being our sponsor each and every week. All right. So, okay.
All right. The last 2 points are pretty vague. Like the rest of it's gonna be pretty quick. I was like struggling with coming up. I'm like, well, these are valid points, but there's not a whole lot to say about it.
Yeah. Well, we can throw some things in there.
Okay.
Ready?
Yeah.
All right, welcome back. Thank you, iMove PT, for being our sponsor. Number 3 on our list of options for keeping an arthritic knee healthy is to eat a balanced diet, low in sugars and low in fats. So, uh, there's no doubt that excessive sugars, cause inflammation. Um, there has been tons of research out on this that and Lauren, you can talk more about, but certain foods are just well, really anything that has excessive sugar in it. If you have inflammation, that's not going to help you one bit.
Mm-hmm. And foods rich in vitamin C, like just fruits and vegetables in general, I mean, it seems pretty obvious, but those will help you. Omega-3 fatty acids will help you. That can be found in fish, whole grains, low-fat dairy, lean meats, healthy foods like nuts, avocados, olive oil. Those are also all helpful for decreasing inflammation in the body.
Yeah, this isn't any new news by any
Mhm.
means. This isn't um something earth-shattering, but it is so true that we are what we eat. And if we're trying to make our body healthy, we strongly encourage, you don't have to, you can have cheat days and you can do all that is fine, but overall you do really need to follow a good healthy diet to give your body the best chance to heal. Also, there's, oh my gosh, there's the intermittent fasting. There is so many different types of diets out there. In fact, in a couple of weeks, we're going to have a nutritionist on, Jillian Warwick, who's going to, maybe weed through some of that out there. But one thing that to me makes a lot of sense, and I actually went on a version of this diet a few years ago, and it definitely helped me lose a lot of weight. I can tell you the weight unfortunately comes back on when you go off of it, but it was a diet that you ate quite often in your day, like 6 times in a day you're eating, um but you're eating 200 calories like 5 of the times you eat. You were eating like whatever 100 200 calories, and then you had one kind of bigger meal each day. But the one thing behind it that made a lot of sense to me was it kept your blood sugar level. It's so many times it's if we don't eat for 5 6 hours, and our blood sugar drops, and then we get these huge cravings where we'll eat about anything. So when I was strict with that, what I found that I just didn't really crave all the sugar, because my body was functioning the way it should be. So anyway, there's all kinds of ways to eat out there, but I think you just have to use common sense. And of course, any type of processed food, which unfortunately makes up a lot of Americans' food, I don't know. It's if you're trying to be healthy, you got to really commit to almost to a lifestyle. You don't have to obsess on it, but you do have to commit to it.
Mm-hmm. And then our fourth point is to avoid repetitive compressive forces. So if you are a downhill runner, kneeler, a repetitive squatter, all of those things, just that compressive force right behind the kneecap will just wear and tear, shear over time.
Yeah, one thing I encourage people, like I love to garden, but when I know that I'm going to be kneeling, like either planting a bush or flowers or whatever, I get one of those little kneeling pads out, and that's a huge help.
Mm-hmm.
We talk about not doing a deep knee bend. Um, However, we don't want you to stop squatting. Squatting is a very functional activity for all of us each and every day, and getting up and down from the floor should be something we all strive to not lose that ability. So we want you to do squats, but perhaps doing a deep knee bend, you got to be careful, and you just have to make sure that you use really good form with that.
Mm-hmm. And then last but not least today is proper shoe wear. So I see this a lot as a PT, that weakness in the hips may cause our knees to cave in, or people that have really flat feet as well. If you're just one of those people that know, like, I have flat feet, every part of my foot touches the ground when I stand. If, the next available joint is also going to follow that joint. So if you have flat feet, your knees are also going to cave in. And if you have knees that cave in, you're going to wear and tear a lot on one side versus the other because there's asymmetry. And same goes for the opposite. If you have bow legs, that's the same. You're going to wear and tear on one versus the other. So, but specifically for people with flat feet or high arches, if you can go talk to somebody and have an evaluation of your arches, or a shoe place that knows what they're doing, find a shoe or like Arthritic or just shoe brand in general that will help you, give you some support and bring the, either shape your arch or bring the floor up to your arch to help you either absorb that shock or put you in a more alignment of your knee joint.
Yeah, those are great points. One thing to really think about too is if you've had shoes for, let's say you've had shoes for a month or two and, you've worn them every day, it's helpful to look at the bottom of your shoe and see. So that will tell you sort of where you're wearing. And if the inside of the sole of the shoe, if the inside bottom is worn down, that's a pretty good sign that you're probably pronating or flat feet quite a bit. And so with someone like that, I do think an orthotic, whether it's a custom orthotic or a semi-custom or something like that, I do think orthotics are helpful because we spend so much time. Well, some people spend a lot of time on their feet, but you definitely need support from the ground up. So we talked about the hips earlier, and yeah, we want to get our hips stronger, but we have to make sure you're wearing appropriate footwear. And then I don't know, I kind of encourage, like, once you find shoes that work for you, I don't know, it could be boring, but I would kind of stick with that. Like, just my own story is, I'm not going to say shoe names, but I had always, worn a certain type of shoe. It was Asics is what I like to wear. And then I'm sure some of you know that there's been a fad in the last, I won't say a fad, but some new shoes that have popped up in the last couple of years, and they're really built up. And there's a few brands, so I won't say what brand, but I then bought that brand and thinking it was going to work because it works for everyone, I thought. And so unfortunately it was way, 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 way too much built up, and I wear an orthotic. So I started to run and I got significant problems on the outside of my foot because I was too built up. So moral of the story is, just when you find shoes that work for you, I would kind of stick with those shoes instead of always trying to find something new.
So just to recap today, that if you have arthritis, we definitely recommend to stay active, consult with a healthcare provider if you need to, but 30 minutes of exercise 5 days a week, like Dr. Gorman said, 150 minutes a week is encouraged. Improving our weight, strength training, flexibility training, all will be great factors to help us out to stay active. Manage your pain, ice, elevation, compression. And then refer to our previous podcasts. If you just know that you've discussed with your orthopedist that you have to go down the total knee replacement route, don't be alarmed. Refer back to one of our other podcasts on post-op care and what you can do beforehand as well. And then our x-ray, we also have a podcast on x-rays. So if you really want to learn more about digging into how to interpret your x-ray and more information on what you can do immediately after the x-ray, refer back to that podcast as well.
Yeah, so please email us if you have questions specifically. And like I said in an earlier podcast, Dr. Bennett will answer emails until 3 a.m. So whatever coast you're on or whatever country you're in, she's more than happy to answer your email. But no, we're here to answer questions. If you also have ideas for future podcast topics, we're always looking for new thoughts and new ideas. So please email it to us at info@imovephysicaltherapy.com.
Thank you.
We so actually before we go, okay, Drew, you're gonna have to cut that. I wasn't quite done yet.
It's like a pause. Okay, thanks. Bye.
All right. Hold
Whoops.
on. All right. We're very grateful for the time that you give us. We know you could be spending your 30 minutes each week doing something else, but we're grateful that you're part of our Healthy Habits for Active Aging podcast. And please don't forget, these are now, each of our podcasts are up on the iMove PT YouTube page. So if you would rather see us talking and making fools of ourselves, please watch it on that. But again, we're very grateful. So Dr. Bennett, what's our topic for next week?
So next week we are going to talk about building muscle no matter your age. How to properly strength train when it comes to like exercise and protein consumption.
Awesome. Well, thank you everyone for your time, and we hope you have a great week.
All right. Thanks. Have a great week.
Bye-bye.